My name's Andy McElligott. I'm the Trust's Medical Director, and one of the areas that I'm accountable for is the quality of the services that the Trust provides. We've got 8 quality goals this year for the Trust. So they are to improve the responsiveness of our services for people who are in urgent need of care, to implement a suicide reduction strategy, to ensure that all of our service users have care which addresses both their physical and their mental health needs, to engender a culture whereby staff feel able to raise concerns about unsafe clinical practice, to ensure we have a workforce whose numbers meet the needs of the service, to work in partnership with other health and care providers, with the voluntary sector and with commissioners to improve services, to ensure timely and easy access to our services. And the final goal is to ensure that we further improve our engagement with service users and their carers. So we went through quite a lengthy process to develop these quality goals this year. We started with an electronic survey of staff members, service users and other stakeholders like our commissioners. So this year, because we're a foundation trust and we have a council of governors, they've come into their own this year in terms of helping us to develop the quality goals. So they looked at the themes which emerged and refined them into the smaller number of quality goals which were then recommended to board for approval. For staff this year, we hope that these quality goals will give them some clear areas to focus on. So what we've asked each of the 4 operational directorates to do is actually to come up with their own separate action plan against each of those goals so that they're more meaningful depending on which service or which team you work in. So hopefully every service will come up with a separate action plan for each of those goals. These goals are not just supposed to sit on a piece of paper, they're supposed to lead to meaningful improvements. So I hope at the end of this year our service users will be able to say, I've been able to see the person I needed to see when I needed to see them. I knew how to access that service, and when I moved between services there were no obvious joins. It was as though everyone was working together as a single seamless team.